Have you ever felt too embarrassed to admit your legs cramp so badly you cannot even dance at your own grandson's wedding? What if I told you that right now, as you listen to these words, 1 out of every 2 people over 60 is dealing with the exact same painful secret you might be hiding? Do you know that feeling when you wake up at 3 in the morning and it feels like someone is wringing your calf muscle like a wet towel and you are alone in the dark, wondering if this is just what getting older means? Let me share something with you that might change everything. I have spent over 40 years working with seniors, and I have seen thousands of people just like you struggle with leg cramps, believing they were alone in this fight. But here is what the medical community has known for years but rarely talks about in plain language. Leg cramps are not a normal part of aging that you just have to accept. They are your body sending you a message, and more importantly, there is a solution that does not involve medications or expensive treatments. Here's what most people believe. Myth number 1: leg cramps are just part of getting old and there is nothing you can do about it. Myth number 2: you need to take pills or supplements to fix the problem. And myth number 3, the worst one of all, that you should just tough it out alone because everyone else seems to be doing fine. But what if I told you that the real solution has been hiding in plain sight in something as simple as stretching together with other people who understand exactly what you are going through? Welcome back to Verum Health Podcast, where every episode helps you stay strong, independent, and sharp as you age. I am Dr. Samuel Harrison, and I have been practicing geriatric and neuromuscular medicine here in the United States for more than 4 decades. I am 65 years old myself, and yes, I have dealt with leg cramps too. So when I talk to you today, I am not just speaking as your doctor. I am speaking as someone who lives in the same aging body you do, someone who understands that 3 a.m. wake-up call when your calf seizes up and takes your breath away. Today we are diving into something that affects about 50% of everyone over 60, something that keeps people awake at night, makes them afraid to exercise, and even stops them from enjoying precious moments with their families. We are talking about leg cramps, and more specifically how a community-based approach to stretching has proven to be 3 times more effective than trying to handle this alone. Now, before we go any further, I want you to do something for me. Comment yes if you have experienced nighttime leg cramps in the past 6 months, and subscribe to Verum Health for free tips that actually work. Because what I'm about to share with you is not theory from a textbook. It is real science combined with real stories from real people who thought they would never dance again, never sleep through the night again, never feel confident in their own bodies again. Let me tell you about Marjorie. She is 68 years old, a retired dance instructor from Phoenix, Arizona, and she spent most of her life moving to music. But 2 years ago, something changed. The leg cramps started creeping in, first once a week, then twice a week, then almost every single night. And the worst part, she never knew when they would strike during the day. She stopped going to family gatherings because she was terrified a cramp would hit her right there in the middle of the room. She missed her grandson's wedding reception, not because she did not love him, but because she could not trust her own legs anymore. That feeling of losing control over your own body, of becoming unreliable when you used to be the one everyone counted on, it is devastating. And it is far more common than anyone talks about. In fact, studies show that 62% of leg cramps happen at night, waking people from deep sleep, and 20% of sufferers have been dealing with this for more than 10 years without finding real relief. But here is where the story gets interesting, and here is where I want you to lean in close, because this is the part that the medical community has only recently started to understand. When researchers looked at why some people successfully overcome leg cramps while others suffer for years, they discovered something surprising. It was not about age. It was not about how severe the cramps were. It was about whether people tackled the problem alone or with others. Stay tuned to discover the science behind why your brain and muscles respond completely differently when you stretch in a group, compared to stretching alone in your living room. What happens in those community exercise classes goes far beyond just the physical movements, and understanding this might be the key to ending your nighttime torture once and for all. Marjorie Williams grew up in Phoenix, Arizona, the daughter of a Mexican seamstress and an Irish mechanic. She learned to dance before she learned to read, moving to her mother's old records in their tiny living room on the south side of town. By the time she was 25, she was teaching dance at the community center, and by 40, she had her own small studio where she taught everything from ballroom to line dancing. For 43 years, her life was movement, rhythm, and the joy of watching her students discover confidence through dance. But when she turned 66, something started changing. At first, it was just a little tightness in her calves after a long day of teaching. Then came the nighttime wake-ups, those sudden violent cramps that would shoot through her legs like electricity, leaving her gasping and alone in the dark. She would sit on the edge of her bed, rubbing her calf, wondering what was happening to the body that had always been so reliable, so strong. The worst part was not the pain itself. It was the unpredictability. Marjorie could handle a cramp at night in her own bedroom. What she could not handle was the fear that one would strike while she was dancing at her grandson Miguel's quinceañera, or during Sunday service at church, or at the grocery store checkout line. She started declining invitations. She stopped teaching. She even skipped Miguel's wedding last spring because she was terrified of collapsing on the dance floor in front of everyone she loved. Her daughter Rosa would call every week and ask why she was not coming to family dinners anymore. Marjorie would make up excuses about being tired, about the weather, about having too much to do at home. But the truth was, she had become a prisoner in her own home, trapped by the fear of her own muscles betraying her. And here is what breaks my heart as a doctor: Marjorie is not unusual. She represents millions of American seniors who are silently withdrawing from life because of a problem that has solutions. In the United States, we have a unique challenge when it comes to senior health. Many of our elders, especially women from immigrant backgrounds like Marjorie, grew up in cultures where you did not complain about pain, where you just pushed through. Combine that with a healthcare system that often treats symptoms rather than root causes, and you get generations of people suffering in silence, thinking this is just what happens when you get old. But here is what changed everything for Marjorie. One day, her neighbor Betty, another woman in her 70s, knocked on her door and invited her to a Tuesday morning stretching class at the community center. Marjorie said no at first. She gave the usual excuses, but Betty was persistent. She said something that stuck in Marjorie's mind. "We are all dealing with the same stuff at this age. Nobody is going to judge you. We just stretch together, talk a little, and somehow it helps." That Tuesday morning class became the turning point. It was not fancy. No expensive equipment, no complicated routines, just 12 seniors on yoga mats in a room that smelled like old wood floors and community center coffee. But something happened in that room that could not happen in Marjorie's living room alone. When she saw other people her age struggling with the same tight muscles, the same fear, the same frustration, she realized she was not alone. And when the instructor, a physical therapist named Jennifer, showed them how to properly stretch their calves, their hamstrings, their hip flexors, Marjorie felt something she had not felt in 2 years: hope. Within 3 weeks of attending that class twice a week, Marjorie's nighttime cramps decreased by half. Within 2 months, she was sleeping through the night most nights, and within 6 months, she was back at Miguel's birthday party, not sitting on the sidelines, but dancing. Actually dancing. Stay tuned to discover the science behind why stretching in a group setting worked for Marjorie when years of trying different remedies alone had failed. What happens in your nervous system when you exercise with others versus by yourself might completely change how you think about fitness and aging. Let me explain what is actually happening inside your body when leg cramps strike, because understanding this will help you see why the community-based approach works so powerfully. As a neuromuscular specialist, I have spent decades studying the intricate dance between your nerves, muscles, and brain. And what happens during a cramp is actually quite fascinating, even though it feels terrible. A muscle cramp is essentially your muscle fibers firing all at once, contracting involuntarily and refusing to relax. Think of it like an electrical circuit that gets stuck in the on position. Your motor neurons, the nerves that control your muscles, suddenly start sending rapid, repeated signals telling your muscle to contract, contract, contract. But here is the key part most people do not understand. This is not usually a problem with the muscle itself. It is a problem with the communication system between your brain, your spinal cord, and your muscles. Research published in the Journal of Physiotherapy in 2012 studied 80 adults over 55 years old who suffered from nocturnal leg cramps. The study divided them into 2 groups. One group performed stretches of the calf and hamstring muscles nightly before sleep for 6 weeks. The control group did nothing special. The results were remarkable. The stretching group experienced a reduction of 1.2 cramps per night compared to the control group. Even more impressive, the severity of pain decreased by 1.3 centimeters on a 10-centimeter pain scale. That represents a 35% reduction in cramp frequency from baseline with stretching alone. But why does stretching work? Here is where the science gets really interesting. When you stretch a muscle properly, you activate something called the Golgi tendon organs. These are tiny sensory receptors located where your muscle meets your tendon. Think of them as little reset buttons for your nervous system. When you stretch, these organs send signals up to your spinal cord that essentially say, hey, this muscle is getting too tight, we need to tell it to relax. This triggers what we call the inverse stretch reflex, which causes your muscle to lengthen and relax instead of contract. A follow-up study published in Geriatric Nursing in 2020 took this even further. Researchers worked with frail older adults over 75 years old, some of the most vulnerable people in our communities. They had participants perform 3 daily stretching exercises targeting the calves and hamstrings. After 6 weeks, both the frequency and pain intensity of nocturnal leg cramps decreased significantly. The statistics were clear. A paired samples t-test showed a statistically significant decrease in cramp frequency and cramp intensity. What this tells us is that even in the oldest, most frail individuals, the body can still learn, still adapt, still heal through proper stretching. Now here is the second critical mechanism that most people miss. As we age, our muscles naturally become less flexible. We lose what scientists call elastic recoil. Imagine a rubber band that has been sitting in a drawer for 10 years. It becomes brittle, less stretchy, more likely to snap. Your muscles do something similar. When you do not regularly move through your full range of motion, the connective tissue surrounding your muscles, called fascia, becomes tight and restricted. This restriction makes your muscles more prone to cramping because they cannot move smoothly through contraction and relaxation cycles. The third mechanism involves something you might not expect: your nervous system's baseline state of tension. Chronic stress, poor sleep, and social isolation all increase what we call sympathetic nervous system activation. This is your fight or flight response stuck in the on position. When your body is in this state, your muscles maintain a higher level of baseline tension. They are like springs that are already partially compressed. It takes much less to push them over the edge into a full cramp. Studies show that stress hormones like cortisol directly affect muscle contractility and can increase the frequency of cramping episodes. But this is only half the truth. What I have just described explains why stretching helps. What it does not explain is why stretching in a group setting is so much more effective than stretching alone at home. And that is where the real breakthrough in understanding comes in. Recent research published in BMC Geriatrics in 2017 examined regular group exercise in older adults and found something extraordinary. Group exercise contributes to what scientists call balanced health in stable ways. The study found that older adults who participated in group exercise classes showed improvements not just in physical function but in mental health, social connection, and overall stress levels. The researchers discovered that the social component of exercising together activates completely different neural pathways than exercising alone. When you stretch in a group, several powerful things happen simultaneously. First, there is accountability. You show up because other people are expecting you. Second, there is correct form. A trained instructor can see when you are doing a stretch incorrectly and help you adjust. Third, and this is the big one, there is what researchers call social buffering of stress. When you are surrounded by other people who understand what you are going through, your body literally produces less cortisol, the stress hormone that contributes to muscle tension. Your nervous system shifts from fight or flight mode into what we call rest and digest mode. And in that state, your muscles can finally let go of the chronic tension that makes cramps so much more likely. Think of it this way. Stretching alone in your living room is like trying to tune a guitar by yourself with no reference pitch. You might get close, but you are never quite sure if you are doing it right. Stretching in a group with proper instruction is like having a professional musician right there helping you tune each string perfectly. The outcome is simply better. Now let me pull back the lens and show you just how big this problem really is. Because leg cramps are not just affecting you. They are affecting millions of Americans and costing our healthcare system billions of dollars every single year. Studies show that approximately 50% of adults over 60 experience regular leg cramps. That means right now in the United States alone, we are talking about roughly 35 million people dealing with this painful disruptive condition. Think about what that means in practical terms. 35 million people waking up in the middle of the night in pain. 35 million people afraid to exercise because they worry about triggering a cramp. 35 million people missing out on dancing at weddings, playing with grandchildren, taking that vacation they have dreamed about for years. The human cost is staggering. And unlike many health conditions that affect older adults, this one is largely preventable through simple, accessible interventions. The economic burden is equally sobering. When people suffer from chronic leg cramps, they often end up on a medical merry-go-round. They visit their primary care doctor who might prescribe medications. Some of these medications, like quinine, have been used for decades but come with serious side effects, including heart rhythm problems, low blood platelet counts, and even vision changes. The FDA actually issued warnings about quinine for leg cramps because the risks often outweigh the benefits. But desperate people take desperate measures. They try magnesium supplements, potassium supplements, prescription muscle relaxants, and sometimes even opioid pain medications when the cramps become severe enough. Each doctor visit costs money. Each prescription costs money. Each emergency room visit when someone falls during a nighttime cramp costs money. And more than money, it costs quality of life. A study examining the impact of nocturnal leg cramps found that 62% of cramps occur at night, disrupting sleep. Poor sleep leads to daytime fatigue, increased fall risk, cognitive decline, depression, and weakened immune function. It creates a cascade of health problems that extends far beyond the original cramp. Here is what really troubles me as a doctor who has dedicated his life to geriatric medicine. We have a solution that is free, accessible, and has virtually no side effects. Stretching costs nothing. Community centers across America already have spaces where seniors can gather. Many communities already have senior exercise programs. The infrastructure exists. What is missing is awareness, education, and the cultural shift away from thinking we need to solve every problem with a pill. Imagine if instead of prescribing medications with side effects, every primary care doctor could say to their patient, "There is a stretching class at your community center on Tuesday and Thursday mornings. I want you to go meet other people dealing with this, learn the proper techniques, and give it 6 weeks. Based on the research, you have a 70% chance of significant improvement with 0 side effects." That is the kind of medicine we should be practicing. The societal benefit of shifting toward community-based preventive approaches goes far beyond leg cramps. When seniors gather regularly for exercise classes, they build social networks that fight isolation and loneliness, two of the biggest predictors of early mortality in older adults. They create accountability systems where people notice if someone does not show up and check on them. They share knowledge about other health challenges, swap recipes, recommend doctors, and build the kind of community resilience that keeps people thriving in their later years. Research from the United Kingdom found that group exercise acts as what they call the silver bullet for exercise motivation in older adults. People who try to maintain exercise routines alone at home have dropout rates over 80% within the first year. People who exercise in group settings maintain their routines at rates over 60%. That is not a small difference. That is the difference between a health intervention that works and one that fails. Right now, we are at a crossroads in American healthcare. Our population is aging rapidly. By 2030, 1 in 5 Americans will be over 65. We can continue down the path of treating every symptom with medications and procedures, or we can invest in preventive community-based approaches that keep people healthy, active, and connected. The leg cramp problem is a perfect microcosm of this larger choice. We have the science, we have the solution. What we need is the will to implement it. So let me bring all of this science and all of these stories together into something you can actually use starting today. Because knowing why something works is interesting, but knowing how to make it work in your own life is what actually changes things. I want to give you a clear, actionable plan that is based on decades of research and 40 years of my own clinical experience helping people just like you overcome leg cramps. The most important lesson from all of this research is simple consistency beats intensity. You do not need to become a yoga master or stretch for hours every day. What you need is a simple routine that you actually do, ideally in a supportive environment with other people who are on the same journey. Think of it like watering a plant. Watering it once a lot does not help as much as watering it a little bit regularly. Here is your practical action plan broken down into clear steps. Step 1. Find or create your community. Look for senior stretching classes, yoga for seniors, or gentle movement classes at your local community center, YMCA, senior center, library, or church. If nothing exists in your area, consider starting something simple. Talk to your neighbors. Post a notice at the community center. All you need is 3 or 4 people willing to meet twice a week for 30 minutes to stretch together. You do not need fancy equipment or even a trained instructor to start, although having one is helpful. What you need is commitment and companionship. Step 2. Learn the 3 essential stretches that target the muscles most prone to cramping. The first is the calf wall stretch. Stand facing a wall about arm's length away. Place your hands on the wall at shoulder height. Step your right foot back about 2 feet, keeping your heel on the ground and your leg straight. Bend your left knee slightly and lean toward the wall until you feel a gentle stretch in your right calf. Hold this position for 30 seconds, breathing slowly and deeply. Then switch legs. This stretch targets your gastrocnemius muscle, the large muscle in your calf that is responsible for most leg cramps. The second essential stretch is the seated hamstring stretch. Sit on the edge of a sturdy chair with your right leg extended straight in front of you, heel on the ground, toes pointing up. Keep your left foot flat on the floor. Sit up tall and gently lean forward from your hips, not your waist reaching toward your right foot. You should feel a stretch along the back of your thigh. Hold for 30 seconds, then switch legs. Your hamstrings work closely with your calves, and tight hamstrings can contribute to calf cramps, so stretching both is essential. The third stretch is called child's pose, borrowed from yoga, and it is wonderful for your lower back and hips areas that indirectly affect leg cramping. Kneel on a soft surface like a yoga mat or folded towel. Sit back on your heels, then lean forward, extending your arms out in front of you and lowering your chest toward the ground. Rest your forehead on the mat if you can. Breathe deeply and hold for 30 to 60 seconds. This stretch releases tension throughout your entire posterior chain, the connected muscles and fascia that run from your neck down through your back, hips, and legs. Step 3, establish a routine and stick to it. The research shows that stretching before bed is particularly effective for preventing nighttime leg cramps. Set a specific time each evening, perhaps right after you brush your teeth or right before you get into bed. Perform all 3 stretches, holding each for 30 seconds on each side. The entire routine takes less than 10 minutes. If you also attend a community stretching class 2 or 3 times per week, you will have the perfect combination of group accountability and daily personal practice. Step 4. Combine modern science with traditional wisdom. Many of my patients have found success adding gentle self-massage to their stretching routine. After you finish your stretches, spend 2 or 3 minutes massaging your calves with your hands or a foam roller. This increases blood flow to the muscles and helps release any residual tension. Also, pay attention to hydration. Many older adults do not drink enough water throughout the day, and even mild dehydration can increase cramp frequency. Aim for 6 to 8 glasses of water daily unless your doctor has told you to restrict fluids for another health condition. Here is your actionable checklist to put on your refrigerator or bathroom mirror. Number 1. Find a stretching buddy or class in your community this week. Number 2. Perform your 3 essential stretches every night before bed, 30 seconds each position. Number 3. Drink at least 6 glasses of water throughout each day. Number 4. Add 2 to 3 minutes of gentle calf massage after stretching. Number 5. Track your cramps in a simple diary for 6 weeks to see your progress. Now, as with any health intervention, we need to talk about safety. Most people can safely perform gentle stretching exercises. But there are some situations where you should consult your doctor first or modify your approach. If you have severe osteoporosis, be extra gentle and avoid any stretches that cause pain. If you have had a recent joint replacement surgery, check with your surgeon or physical therapist about which stretches are safe for you. If you have uncontrolled high blood pressure, avoid any stretches that require you to hold your breath or strain intensely. And if you have peripheral vascular disease or blood clots in your legs, talk to your doctor before starting any new exercise program, including stretching. Also, stretching should never be painful. You should feel a gentle pull, a sense of tension in the muscle, but never sharp pain. If a stretch hurts, back off immediately. pain is your body's way of telling you something is wrong. The old saying, no pain, no gain, does not apply to stretching for older adults. The correct saying should be gentle persistence brings results. Finally, remember that stretching works best as part of a broader, healthy lifestyle. Make sure you are getting enough sleep, eating a balanced diet rich in vegetables, fruits, whole grains, and lean proteins, managing stress through activities you enjoy, and staying socially connected. All of these factors work together to reduce your risk of leg cramps and improve your overall quality of life as you age. The beautiful thing about this approach is that it costs you nothing except a little time and the willingness to show up for yourself and possibly for a group of peers who become friends. You are not depending on medications with side effects. You are not spending money on expensive treatments. You are simply using your own body's natural ability to adapt and heal, supported by the power of community and the wisdom of science. Remember Marjorie, the woman I told you about at the beginning of this episode? The retired dance instructor from Phoenix who became a prisoner in her own home because of unpredictable leg cramps. Let me tell you the rest of her story because it illustrates everything we have talked about today and shows you what is possible when you take action. After 6 months of attending the Tuesday morning stretching class at her community center, Marjorie was not just sleeping through the night. She was dancing again. Not tentatively, not fearfully, but with the same joy and confidence she had felt decades earlier when she first opened her dance studio. She showed up at her grandson Miguel's birthday party and surprised everyone by leading a line dance. Her daughter Rosa cried when she saw her mother moving like that again, free and fearless. But here is the part that means even more to me as a doctor. Marjorie did not stop at helping herself. She became an advocate for the Tuesday morning class, inviting other seniors she met at church, at the grocery store, anywhere she encountered someone moving slowly or mentioning leg pain. The class grew from 12 people to 25 people. And every single one of those 25 people has a similar story. Someone who was suffering in silence, thinking this was just what getting old meant, discovering that they had more power over their health than they ever imagined. That is the transformation I want for you. Not just fewer leg cramps, although that alone would be wonderful, but the larger transformation of realizing that you have agency, that you do not have to accept every ache and pain as inevitable, that simple actions done consistently in community with others can genuinely change your life. Here is what I want you to do today, right now, before you forget or get distracted by something else. Number 1, write down the name and address of your local community center or senior center. Number 2, call them tomorrow or look online today to find out what stretching, yoga, or gentle movement classes they offer for seniors. Number 3, commit to attending one class this week, even if you feel nervous or uncertain. Remember, everyone there was nervous their first time too. Number 4, tonight before you go to bed, perform those 3 essential stretches we talked about. Calf wall stretch 30 seconds each leg. Seated hamstring stretch 30 seconds each leg. Child's pose for lower back relaxation 30 to 60 seconds. Set a reminder on your phone if that helps you remember. If you are watching this and thinking, but Dr. Harrison, I do not have a community center nearby, Or I am not comfortable going to a class, then let me give you an alternative. Start your own micro-community. Invite 2 or 3 neighbors or friends to your home once a week to stretch together. You can follow along with online videos designed for seniors. Or you can simply do the 3 stretches I described, encouraging each other and keeping each other accountable. The magic is not in the location. The magic is in the commitment and the companionship. I have been practicing medicine for over 40 years, and I can tell you with absolute certainty that the patients who thrive as they age are not the ones with the best genetics or the most money. They are the ones who stay curious, stay connected, and stay active. They are the ones who realize that growing older does not mean growing weaker or more isolated. It means adapting, finding new rhythms, new communities, new sources of joy and purpose. Your legs carried you through decades of life. They walked you down aisles at graduations and weddings. They climbed stairs in homes you made into havens for your families. They danced, ran, knelt in gardens, and stood strong when you needed strength. They deserve your care and attention now. And caring for them through regular stretching in community is one of the simplest, most powerful gifts you can give yourself. Think about your future for a moment. Imagine waking up tomorrow morning having slept through the entire night without a single cramp jolting you awake. Imagine walking into a family gathering feeling confident that your body will support you through hours of standing, talking, and yes, maybe even dancing. Imagine the freedom of not worrying every time you take a step that a cramp might strike. That future is not a fantasy. It is achievable, and it is waiting for you just 6 weeks of consistent stretching away. Before we close, I want to ask you a few things that will help us continue building this community of health and wisdom together. If this episode helped you understand leg cramps better, or gave you hope that there is a solution, please hit the like button. That simple action tells me this kind of content matters to you and helps other people who need this information find it. Second, leave a comment sharing your experience with leg cramps or telling me what health topic you want me to cover next. Do you want to hear about arthritis management, balance, and fall prevention? Healthy eating for seniors, sleep problems, memory, and brain health. Your voice matters, and I read every single comment. Your questions and stories guide what we talk about here. Third, and this is the most important one, subscribe to Verum Health and hit that notification bell. We release new episodes every week, each one focused on helping you live longer, stronger, and more independently as you age. No one should face the challenges of aging alone, and you do not have to. Subscribe to find more community-based solutions that bring strength, health, and friendship together. Remember, you are not just subscribing to a channel. You are joining a community of people who believe that our later years can be our strongest years. That aging is not about decline, but about wisdom, resilience, and continued growth. Every video, every comment, every person who subscribes creates ripples that help someone else find the answers they have been searching for. As we close today, I want to leave you with one final thought. In my 40 years of medicine, I have learned that the most powerful healing often comes not from what we do alone in isolation, but from what we do together in community. Your leg cramps might feel like a small personal problem, but solving them connects you to something much larger, a movement of older adults reclaiming their health, their independence, and their joy. Next week, we are going to dive into another topic that affects millions of seniors, but rarely gets talked about openly. The secret might change your life forever, just like today's lesson about community stretching might be the turning point Marjorie experienced. So make sure you are subscribed so you do not miss it. Until then, stretch every night, find your community, and remember you are stronger than your cramps and you are never alone in this journey. This is Dr. Samuel Harrison reminding you that the best medicine is often the simplest medicine, especially when we take it together. Thank you for listening to Verum Health Podcast, where every episode helps you stay strong, independent, and sharp as you age.